Welcome back. Dr. Jay Larson and Dr. Jeff Rausch are staying with us to continue our discussion on complementary or integrative healthcare approaches. Thanks for sticking around. Yeah. So my first question is for you, Dr. Larson. We've been learning about complementary medicine, but could you give some examples of when people might use that healthcare approach?
Well, for instance, some women who have symptoms related to being postmenopausal need hormone replacement, but they don't do well with what we have available through prescriptions. And so often I'll refer them to somebody like Dr. Rausch to use supplements that are available to him. And he probably understands more about concentrations, delivery systems than I do, because they're not traditional prescriptions.
Okay, and I think we've talked about some of the benefits of maybe using a complementary healthcare approach if that's something someone would like to do, but let's be specific. Dr. Rausch, what would you say are the benefits to this kind of a healthcare approach?
Well, I think, to use the term holistic, I think that would be a good term to define it. I mean, I think that it is a whole person approach because when if you look at, let's say, naturopathic medicine, I mean, we spend an inordinate amount of time talking about lifestyle, diet, exercise, stress management, and that would be well combined, in my opinion, with, let's say, a patient with heart disease who also needs medicines, So I think it's a much more rounded approach if that could happen. Yeah.
Okay, and then on the other side of that coin, risks. What are some of the risks that people should be aware of if they try to seek out this sort of an approach?
Well, from a lifestyle point of view, everything that Dr. Rausch does is great. The question is if they get a supplement that may have a drug interaction with one of the prescription medicines would be the main concern I would have.
Okay. Would you add anything?
Yeah, I highly agree with that. I mean, I would say that there are some herbal medicines in particular that could, increase the effectiveness or decrease the effectiveness of certain medications. So, and that could put the patient at risk of side effects. So I think that they need to speak with somebody who's licensed and has knowledge around that to know what those interactions might be.
Okay, and we've talked a lot on this show about making sure that people are open and honest and can have conversations with their healthcare providers. But for something like this that's maybe not heard of or not as common, would you give advice to a patient who wants to approach their primary care physician or a medical doctor about maybe seeking out a complementary medicine healthcare approach?
Well, I think it's reasonable for the patient to be able to inform their primary care provider, though depending on the provider's point of view, they may be dissuaded not to do it. But the patient has their choices. They can find what works best for them.
Okay, perfect. All right, so if I am doing a complementary medicine healthcare approach and something is wrong with me, I feel sick or there's something physical, where do I start? What would you recommend? Which doctor do I go to first?
Yeah, I mean, I would say you could, ideally you'd be able to go to your primary care doctor, the person who's overseeing the vast majority of your care. That would be I think, ideal person to know what's going on with your health care.
Okay.
But if you're working with a licensed provider, I would say you just need to be able to speak up and let somebody know that you're not feeling right.
Okay, great. So Dr. Rausch, are there more common types of complementary medicine that you practice or that people take advantage of compared to others?
Well, there's definitely things that I do that people take advantage of. As I mentioned, lifestyle approaches, herbal supplementation, hormone therapies, but there's things that I don't do as well that I think other people could take advantage of. Things like mind-body medicine, yoga, meditation. Acupuncture is very popular. I don't do acupuncture, but that's certainly a very popular treatment.
Okay, and then Dr. Larson, are there complementary medicine approaches that you tend to recommend or suggest more often, or other medical doctors in general kind of turn to as being pretty common?
I actually use a number of different therapies. I often recommend acupuncture for pain syndromes. There is something called Bowen therapy in which they work on the fascia. It's the connective tissue around the muscles. Sometimes it can be quite painful. Yeah. Okay.
And so we're about running out of time here, but we have a couple more minutes. If somebody is interested in this, if this is the first time they've heard of it or they've been thinking about it for a while, just in general, tips or advice that you would give to folks about thinking about balancing out Western medicine with some of that complementary medicine approaches?
I just think that people are going to need or would need to find a licensed healthcare provider or a qualified healthcare provider in that particular profession to seek guidance. As a licensed provider, you're bound just like any other provider would be, and carrying a license usually means that you have education behind you as well.
Okay, Dr. Roush, you've talked a little bit about prevention and lifestyle and that you do a lot with that with patients. So if someone doesn't have a sickness or isn't looking for a treatment, what would they come to you for as far as prevention goes?
Yeah, so I like to kind of separate prevention into two different categories. Screening prevention, which would be what people, I think, when they think of prevention are most educated around. That would be your screening exams for things like cancer, et cetera. We do that, but the other thing we do is we talk a lot about prevention regarding lifestyle stuff. So I would say there's probably maybe four things that I really try to focus on. One would be nutrition. The second one would be activity or exercise. The third would be stress and stress management. And I guess the fourth one, which would probably be one of the most important things, would be sleep and making sure that people are getting adequate sleep. So we would be reviewing what that might look like for the patient and how we could best address it, because without that, their health would probably be compromised in some way.
Okay, great, perfect. Thank you so much to both of you for being here with us this morning and all that great information. We are going to take a break, but coming up next, we've mentioned natural products and dietary supplements as a popular part of complementary medicine. We're going to dive a little bit deeper into those and what you need to know when adding these products to medications that you're already taking. Don't go away. We'll be right back after these messages.